Hello, my name is Lucy Lafay. I'm a pediatric oncologist in Calgary, and then the focus of my research is on brain tumor that affect young children, particularly one called atypical teratoid rhabdoid tumor, or ATRT, tumor that affects essentially infant and toddler. So we set up the first Canadian registry for patients with ATRT, and that was the first of its kind. And that effort was later on boosted by a grant awarded by C17, which not only allowed us to have more patient information, but also to collect tumor tissue for those patients, to analyze and then describe the molecular landscape of ATRT. What we've learned with that research is that, in fact, ATRT is made of 3 different subgroups with different clinical characteristics, different prognosis, and essentially different molecular pathway that could potentially become targets for new therapy. The other thing is, as we were looking at how those patients had been treated, we realized that in Canada, unlike other countries, most of the other countries in the world, some of those patients had been treated without radiation and were long-term survivors. We'd like to be able to describe and then know for sure who are those kids that can safely be treated without radiation. And also, as we see more of those patients surviving their disease, we want to be able to describe how they're doing on the long term, specifically in terms of quality of life, in terms of how they're doing at school. And then importantly as well, we want to be able to bring that knowledge to clinical practice in the form of a new clinical trial with more specific medication that target those molecular pathways, with the hope that we'll be able to treat more and cure more patients and have less toxicity.